Hi, so I am Dr. Patricia Sheehan from SETU in Waterford, and I am here today to talk to you, I suppose, about small steps that make a big impact on your life when it comes to physical activity and cancer reduction. We're going to look at why it matters, how we can build these small steps into your life, and then what I really want to do is show you and open your eyes to real life examples of what's actually out there. So we know that cancer affects almost every family in Ireland, with one in two of us receiving a diagnosis in our lifetime. And while some risk factors like age or genetics are just beyond our control, others are not. And physical activity is one of those most powerful tools that can actually influence our lives. The World Health Organization estimates that up to half of cancers could be prevented through lifestyle and environmental changes, and movement really plays a major role in that. So, looking at the evidence, we now have actually got really strong evidence that being physically active lowers the risk of several common cancers. So, if you take a look over here at this nice infographic from Patel and colleagues, you will see that it reduces your risk of seven different cancers, particularly bowel, breast, and womb cancer. Importantly, this isn't about being an elite sport participant or intense training. These benefits are actually seen with moderate, regular movement, such as your walking, your cycling, and just being more active during your daily life. So, how does the exercise reduce the cancer risk? And how does physical activity help? We don't need to know all of the biology to benefit from movement, and I'm going to keep things simple. I'll keep the science light, but I'll give you the strong take home message that you need to understand. Physical activity pretty much helps your body and your systems to work well. It does this by reducing things like inflammation, helps regulate your hormones, which are also linked to cancer risk, and it supports immune health and helps prevent excessive weight gain. And all of these factors together contribute to lowering your risk of cancer over time. Now we actually have evidence to suggest as well that exercise doesn't just reduce risk, it actually improves outcomes. And by being physically active, it's associated now, we know, with lowering risk of reoccurrence, reducing cancer-related mortality, and the benefits are seen after diagnosis, not just before. And I have some really nice quotes from the people who matter most to me at this, in all of this research, which are my participants. So I now feel healthier than I was before. I'm back in work full time. I have great energy, sleep better in the nighttime. I don't have that interrupted sleep because the tiredness I have is a genuine tiredness at the end of the full day. You haven't only saved me, you have given a family back their mother and their wife and their sister and friends back. So I think that that is what's really important, that you are giving people back their role and you're giving people back their sense of purpose. But by not only this, you are also reducing their risk of a further reoccurrence. And large reviews of the evidence show that people who are physically active after a diagnosis have a lower risk of reoccurrence and improved survival. So movement doesn't just matter before cancer, it matters during and after the treatment because it supports people across the entire cancer journey. What I picked up on throughout my research is that there is a real fear of exercise and cancer. People are afraid of exacerbating potentially their cancer-related fatigue, which is the most debilitating side effect of cancer and its treatment. Um, and this fear often can come from what a person says or from the advice they may have received and focusing on what I can't do rather than what we can do. There's fear of injury, there's fear of increasing pain. Here's some quotes from the research I had looked at. I was afraid then to do something because it was a case of if I did it, I'll be tired. Then I'm on my own with the kids. So tomorrow I have to be able to work and look after them. And you do actually become, Asher, look, I'll do nothing because I need to save my energy for tomorrow. Another quote, we were told, like, don't put a heavy handbag on that shoulder. Mind the shoulder where I had the reconstruction. Mind the reconstruction. Be careful, with the safety belt in the car. All of them things like, what I mean. And you're always kind of fearful and fretful that something could happen. However, what we need to do is we need to get the message across that exercise is safe, especially during treatment. The evidence is clear. We have this from the American College of Sports Medicine's Special Interest Cancer Group that exercise is safe for most people with cancer, including during treatment when appropriately guided. In fact, people are actually encouraged to avoid prolonged inactivity and return to normal daily activities as soon as possible. Movement doesn't have to mean going to the gym. This is something that I really want to enforce today. You don't have to go to the gym or make a big, huge lifetime change. It's about really enforcing that every movement count or every move counts. So again, we can do this in our everyday life by making movement part of our everyday life. So at home, little short walks. If you find yourself sitting too long, get up, move about, do things that you may enjoy doing, like you're hoovering, you're cleaning, getting out and about in the garden, some short walks, little light strength exercises. And again, moving yourself during the TV or even getting up to switch off the TV rather than using a remote control. At work, things like, again, interrupting that sitting is so, so important. Maybe walking during your calls. I always say to my dad, that's a mobile phone for a reason. It'll keep you mobile. Active commuting where possible, where potentially the distance is short enough for you to actually walk. And sometimes I even do it whereby if I have to park a distance, I try and beat the shuttle bus up to the car park in SETU in Waterford. And oftentimes we can actually get there faster by walking. In the community, then, there's things like your walking groups. You have those beautiful green spaces. We were blessed in Waterford with our Greenway and all of those community-based programs such as ExWell, which I'll speak about a little bit further on. For me, it's about translating that research into practice. And I have a real graw for doing that. If we know that something works, we owe it to the participants, and ethically, we need to translate that into practice so that the research doesn't sit on the shelf and it reaches the people where that need it most. And there are our cancer patients and the general population to reduce the risk of cancer within the country of Ireland and worldwide. So why community matters for me is people are more active when exercise is accessible. So if the environment is set up for you to become more mobile or include movement, you're more likely to engage in it. It's also really important that we have some sort of social support or support is available for us. Activities that feel safe and enjoyable, you're more likely to carry those out as well. And for me, community-based programs really, really bridge the gap between evidence and real life and play a really, really important role of translating this evidence into everyday life, helping people then feel more confident, safe, and supported to actually move more. So a good example of how research can be translated into practice is the ExWell program. And ExWell delivers clinically supervised exercise in local communities. Again, it's about making you feel safe. And it's for people living with and beyond cancer, but also people with additional chronic illnesses. It is grounded in evidence and as I said, that's what's really important today. And it's grounded in the evidence that I've chatted to you about. But more importantly, it's designed about real people, not ideal scenarios. The focus is on safety, confidence, and enjoyment, helping people rebuild fitness, independence, and well-being in a way that feels achievable and supportive. ExWell, it isn't a one-size-fits-all solution, but it shows what's possible when physical activity is embedded into care pathways and supported beyond the clinic. Because programs like this, alongside other community and clinical initiatives, are essential if we want people to benefit from physical activity and make sure that it is accessible to everyone. So you can see here on the map, I have the locations that are throughout Dublin. There's a huge amount in Dublin and Dublin City, but not just Dublin City. We have them all over the country. And I have the Ireland map up there for you so you can see additional places. They have a fantastic website. They're on all the socials like your Instagram, your Facebook. So definitely take a look, and maybe it's something that you would like to even go have a look at. I'm sure that no centre would ever turn anybody away. So even getting in the door is your first step to actually getting involved. Another piece of research that I was involved in, and I need to again address the fact that it is not a one size fits all. And sometimes people don't maybe like going to the gym. So I was very lucky to be involved in a program that we call the Daisha Dance Project. And it was a pilot evaluation of a dance intervention for young women following cancer treatment. And what the aim was to again have that peer supported dance program for young women who were more than 6 weeks post treatment for primary lymphoma, leukemia, and breast cancer diagnosis. And what we did there, we again remember bringing it back to what they say about the support. It was a buddy system, and we have now translated that into practice. It was really, really well received, and we found that it was absolutely feasible. So that is up and running as well. It's a dance program that's run out of the Solace Cancer Support Centre in Waterford. Another example of how we're working to translate evidence into practice is the REACH project, which I am a principal investigator on with my wonderful PhD student Elisa. REACH is a Government of Ireland funded research project which focuses on one core question: how do we make evidence-based physical activity easier to access for people living with and beyond cancer? So what we're doing is, in simple terms, quite basically, we appreciate that there are, I suppose, resources out there, there are interventions out there, but what we want to know is identify, well, what are the really good ones that work? What is the evidence-based ones? And we're creating almost like a suite or a menu of options. And we have those scored where we have almost like a top five. And now we've done that. And I mean, I make it sound easy, but that was almost 6 months of research. And that now has been condensed into like a suite or a little menu of options for patients that we will translate out and test as well. On this, I would also like to bring your attention to the fact that we don't actually know the physical activity levels of Irish cancer patients. And this is something that's extremely important. So I have a QR code to the study that we're actually undertaking. And I would only love if as many people who are affected by cancer or have had a cancer diagnosis could take part, because that way we will be able to look at that evidence and have an Irish statistic rather than basing ourselves on others throughout the world. This is one I'm very excited about, and I'm really glad that and happy that we have received seed funding from the Irish Cancer Society to make this happen. We know that exercise plays a critical role in prostate cancer survivorship, but we consistently see that men don't engage in the traditional gym programs. Therefore, I've developed along with my research team, the Men United, to address this gap. And it's informed by strong international evidence, particularly the Danish football prostate cancer initiative. It's the Danish FC, where I went and watched and saw that in life. And that uses recreational football as a culturally familiar, male-friendly way to support physical activity. And the programme has shown excellent feasibility and accessibility. So what we're looking to do is translate this evidence-based model into an Irish community context using sport and community settings to provide an accessible and appealing pathway into physical activity for men living with and beyond cancer. So again, that is just identifying that it's not a one size fit all. So let's try and look at ways that we can, I suppose, have those small steps to make the big impact. So, to finish, the message is actually a very hopeful one. We now have strong evidence that physical activity resources reduce cancer risk and support people's cancer journey across the cancer care continuum. We know it's safe, and we know that any movement is better than none. What matters now is telling people that they should do, but making it easier for them to do something. That means access, support, choice through programs that are evidence based, community embedded, and designed around real lives. Small steps really do matter. And when those steps are supported, they can make a big impact for individuals, for communities, and for cancer prevention. So knowing is not enough. We must apply. Willing is not enough. We must do. We need to reach everybody to have that positive impact. And leaving research results on a shelf, it's not just an opportunity. I suppose it is, it's ways of actually providing and seeking hope and healing to the people that matter most. So again, thank you for being part of this amazing webinar. Especially like to thank the Irish Cancer Prevention Network for hosting it on World Cancer Day, all of my research participants, all of the funding and strategic partners that we have, the healthcare professionals, colleagues, professional networks, our cancer support centres across the country of Ireland, but most of all, the webinar participants for joining our webinar today. And thank you as well to all the participants who've taken part in my research.